Hello everyone. This video will cover the social work role on medical teams. This looks at the medical care view of public health. Medical care rather than public health. It talks about the social work role in two ways. This video will cover micro and meso practice work, and we'll also look more broadly at the social work role in macro uh, healthcare. And so that would also align to some of the principles that we've been learning about how policy and administration of hospitals, understanding public health issues in terms of public health, and it also help understand better the social work role. Sometimes when you're thinking about public health and social work, even from a macro perspective, having a firm knowledge and understanding of what the role of social work looks like on medical teams also helps you conceptualize what that work will entail with individuals, families, and larger systems. Social work approach in healthcare settings. The social work approach in healthcare takes a person-centered view. Um, the difference between the approach of social work as opposed to traditional medicine is that social work tends to apply the lens of biopsychosocial, and some would say a biopsychosocial spiritual lens versus the medical model, in that it's person centered. So when we're looking at the person specifically and how to help improve health outcomes for a person and or a population, we want to look at the biological elements, psychological and social, and again, a more comprehensive model is the biopsychosocial spiritual. And even though the interdisciplinary, um, the biopsychosocial model or the biopsychosocial spiritual model is an approach used by social work, we do use or apply the interdisciplinary team to the use of the biopsychosocial spiritual model. So, for example, when we're considering a healthcare setting, and we're looking at how the biopsychosocial spiritual model impacts an individual or families. We're looking at one, the biology, what are the health issues and are there genetic predisposition for that? Is there health behaviors of that person that may be impacting the biology? So that is, think about illness, think about viruses, think about the scientific biological component to the health issue. So we're always considering that. Why is the person ill? What are the symptoms of the illness, the biology? How is the person, how long is the person going to be um, um, affected by, from a biological standpoint, from the issue? And what does that look like? So we're looking at biology, and biology can be um, um, specific biology in terms of concerns itself with how a living organism is impacted. Think about uh, public health issues and its impact on the biology, the person's biology. When you're thinking about interdisciplinary use of the biopsychosocial model, you may look at the doctors or the nurses as impacting the biological area of assessment and intervention. Interdisciplinary use of the biopsychosocial perspective may look at how a psychologist, a psychiatrist, and or a social worker, clinical social worker, may assess and address the psychological components, and how a social worker specifically may address the social components. So again, it's understanding the interdisciplinary players and how they impact how you're viewing a health issue with a specific person, or public health issue with a specific person. And that's again keeping the person at the center of the unit of focus in the biopsychosocial perspective. It also leverages players to treat and support the person. So it's understanding the role of each of those um, disciplines in viewing the assessment and intervention from the biopsychosocial model. But how then are the roles of those players going to help support the needs of the patient or an individual person? This is a poll, and the question here that I want you to reflect on is, what do you consider the biopsychosocial approach? What does it mean to you? Are you familiar with it? And what are the key elements within the biopsychosocial approach? Here it is. When you look at the biopsychosocial, it breaks down into three elements. But when you think about biology, think about pathology, think about disease, think about symptoms, science, doctors, treatments, and tests. My long-term health conditions are biological in origin, but the impact has been felt physically, psychologically, and socially. My long-term health condition can't be treated just through the biological medical model alone. The medical support keeps me alive, but it is the psychological and social support that enables me to live. And those two statements help you understand the impact of the biopsychosocial model and how we look at each element of that model as advancing quality of life and well-being for an individual patient. The psychological component deals with elements such as depression, stress, anxiety, guilt, identity, tears, crying, mood, other things to think about, trauma, in terms of the psychological component. The social component, think about hobbies, families, isolation, money, career, friends, and burdens. So the biopsychosocial model is always and continuously assessing and interventions, assessment and intervention, and evaluating these areas in an individual life. And how the biopsychosocial model works is that by understanding these three units, and spiritual is also another component of that, it helps us understand the patient better, and it helps inform our assessment. Once those assessments help us get a better, clear understanding of what's going on with the patient, then what we can do is develop or customize an intervention plan based on the results of the biopsychosocial assessment, and or biopsychosocial spiritual assessment. And again, understanding how the key players on the medical team or your interdisciplinary team, how they help impact these areas based on the information that you get from the biopsychosocial perspective and model. Um, there's been some evolvement of the biopsychosocial models over time. And this here gives you an idea of the origins, or how it looked originally and how it has expanded over time. The biopsychosocial model, in its origins, focused specifically in the areas that I just recently discussed: biological, psychological, social, behavioral, and environment. In 2003, Lawman expanded the biopsychosocial network to include general health status, social networks, and cultural context as well. And so basically using the language of the original biopsychosocial model, but then also extending key concepts. So not just think about the biology, but also understanding general health status as it relates to the biology. And also, when you're thinking about the social and behavioral, expanding it to consider social networks of people and the culture of an individual as well. The original PowerPoint is listed in your folder, but here you will see um, a podcast that goes more in detail on the biopsychosocial spiritual assessment. Please click on the link in your original PowerPoint to access this podcast and listen to it. And then we come to the social work practice section. What do you think a hospital social worker would capture in an assessment, and particularly a biopsychosocial assessment? That is what this poll here would show you. And if we were in a live class, you would actually use your cell phones to answer this poll in real time. But for the purpose of this video, I want you to think as I come across those areas and challenge your reflection in these areas. So here are some of the things that are covered in a biopsychosocial assessment and an individual and family assessment. You want to understand and have a better comprehension of an individual and or the family, or an individual in context with their family. Some of the other things you want to understand in a assessment are care challenges, right? Are there intellectual developmental disabilities? Are there literacy concerns for that particular client slash patient? Are there physical health impairments or a language and cultural challenge? Um, Another area that you want to look at in an assessment will be a socioeconomic status and resources, a mental health, emotional history such as trauma, bereavement, or disorders, and social support and role of the family. When you're thinking about the biopsychosocial models, consider each of these areas and where they would fall in the biopsychosocial model. Would care challenges, literacy, physical impairments, language, would it fall in the biopsycho or social? When you're thinking about the socioeconomic status and resources, would that fall into the biopsychosocial assessment? Um, Mental health, emotional history, would that fall into the bio, psycho, or the social area of your assessment? And social support and role of family, would that fall in the bio, psycho, or social area? But these are all the things that are important to ascertain, and this is what the role of social work is responsible for in health settings. Also, when you think about individual and family interventions, the role of social work addresses the psychosocial issues, remove barriers to medical treatment, respond to violence, trauma, and abuse. The social worker links to community and government resources, and improve collaborations and relationship between patient, family, and staff. This is what social work assessment intervention looks like on the micro level. Again, understanding the role of social work in healthcare on the micro meso level will also help you understand how macro level practice complements this and has similar goals and mission, but looking at more larger populations. Assessments. When you think about the team in an organization, the organization in which a social worker may work in, there are also assessments that they are making of the health team. And that's the ability of the team and or the organization to meet the bio, psychosocial, spiritual needs of an individual and or the family. So as we are assessing the individual, we're also assessing the ability of the care team and the setting, the healthcare setting, to address the needs that were identified in the biopsychosocial spiritual assessment. Are all the required providers present? You want to understand the capacity. If you find that there are areas in your assessment related to the psychological arena that needs to be addressed, but yet you're working in a setting that doesn't have a psychologist or a clinical social worker, that needs to be assessed. And you need to have a good idea of whether what the needs are and the capacity to meet those needs. That's the role of the social worker. Care coordination and quality of care coordination is also the role of the social worker. Understanding that parts of the care is connected and streamlined. So, for example, if there's an assessment done that a client or a patient has a substance use challenge, it may be required, or the intervention that may be applied is that that patient is transferred to an outpatient or inpatient substance use facility to address their condition. Um, and also understanding that maybe what brought that patient to the healthcare center is health complications related to substance use. So they may have a high blood pressure, or they may have other conditions that's specifically related to the drug use, and the medical team is providing care for that medical issue. But come to find out through your assessment that, yeah, that's the medical issue, that's the problem, But the reason why that medical issue is progressing or worsening is due to substance use and or addiction. And so the social worker in that situation can decide to refer that client to substance use. So the question is there a substance use or a substance abuse counselor on staff there at that health setting? Or would the social worker have to refer out? And that's one of the assessments that the social worker will make. Once the social worker has decided that there is nobody there in the health setting that can meet that need, they refer out. Then the goal is to coordinate that care to make sure that patient is actually transferred out of the healthcare system once their healthcare issues are resolved so that they can focus on their substance use. And care coordination is key in that. Making sure care is transferred to a facility in which can meet the needs of the patient. Either it could be an area where that the healthcare team can't meet that need, or it may be a progression of care or a specialty care that's needed. And so not only just to make sure that care coordination, that referral occurs, and that all the key people are involved to make sure that referral or that transfer of care occurs, but also then making sure that it's a quality, meaning there's not a drop in service, gap in service. Think about access to service with insurance. Think about making sure that the patient can actually be seen at that facility that you refer them to. Making sure that the time between transfer is relatively short, and making sure that the facility itself that you're sending that client to is a high level or a good quality service. And so that's how you think about quality of care coordination. Intercommunication between providers is also key. Making sure you assess and know that there's good communication between providers. That's important, particularly for care coordination and quality of care. But also, it's good to be able to discuss that intercommunication between providers are important because you want to be able to discuss your outcome of your assessment with your care team or your colleagues so that they understand what the needs are and everyone is in agreement in terms of the next steps, the action plan, the treatment plan that must occur. In our example that I just gave, intercommunication between providers will be an assessment where the social worker may bring to the providers, the medical providers' attention that the health issues are grounded in a more serious problem, which a more serious chronic issue, which would be substance use. Intercommunication between providers will be the social worker informing the medical team that a referral is needed, either to outpatient or inpatient, and why, based on what the assessment has yielded. Also, intercommunication between providers will be use of other resources in the client's um, environment that you know about from the biopsychosocial assessment, meaning use of family, use of resources, insurance, finances. You would discuss any barriers or supports to the plan for substance use treatment. And then it will be communication between providers of timeliness. When would that patient be discharged? When would their medical needs be addressed in a timely way to where you can initiate your referral for the next steps for treatment for that particular client? That's what intercommunication between providers would look like. Also, intercommunication between providers may be enlisting additional providers if necessary to treat substance use. So, for instance, if you think in terms of your assessment that a lot of the substance use issues come from a history of trauma with that particular client, you may enlist the help or support, an assessment or an evaluation by a psychologist as well. And then you can use that assessment from the psychologist to include in your care coordination information when you transfer that, work on the referral and transfer of that client to a substance use facility. Do the providers understand the biopsychosocial spiritual assessment? Another important area is to make sure that you're communicating the assessment, the intervention, and plan, and hopefully have a method of evaluating your involvement in your assessment, way of evaluating your intervention to make sure that it's actually useful for the client, the patient. Medical team and organization. Does the medical team know how the biopsychosocial spiritual assessment impacts care? right? So you want to make sure that the team that you're working with or the health setting in which you are located understands the importance of the biopsychosocial model. And it's important because it differs from the medical model. It is so different than a medical model that social workers have to effectively communicate how it impacts the care because it's a very different way of viewing a patient. The medical model usually focuses more on illness, treatment, addressing issues when medical issues when they're a problem, and the biopsychosocial model is more comprehensive. Is the medical team sensitive to culture and spiritual aspects of the client? You want to assess that. You want to assess their understanding of the biopsychosocial spiritual aspects. You want to assess as the social worker, the team or the healthcare setting sensitivity to culture and spiritual aspect of the client and making sure that it's recognized and respected. Um, does the medical team include the biopsychosocial spiritual assessment and the treatment and discharge planning? Are they considering the individual and the family strength specifically? Are they understanding the resources, family support, socioeconomic status? Are they considering mental health? Um, um, the biological area of the biopsychosocial spiritual assessment, the medical team most likely will have a very clear understanding of because that showcases their strengths and areas. What they may not be as strong about is understanding the psychological and the social impacts of your assessment and intervention, and so making sure everyone is on the same page. And again, that's part of what the social worker needs to do in practice, but it's also part of their assessment. So they're not just assessing the client from a micro level, but they're also assessing the family and that biopsychosocial spiritual, and they're also assessing the agency as well and their capacity to meet the needs of the client. If the team and organizational assessment is satisfactory, great. And so if you find that everything is aligned, meaning that you've done the assessment and you know what the needs are, you know how to construct an intervention plan or treatment plan to address those needs, and the medical team is all aligned with that and they understand it and are supporting of the biopsychosocial um, process, then that's great. But what if the assessment outcomes are not good? You know, what can social workers do if the medical team or organization cannot meet the needs of the family? Welcome to social work practice in healthcare. It's very rare that the moons align perfect. There can be challenges at every step in the assessment. Medical team may not. Sometimes their assessment outcomes are not the needs that you identify from the biopsychosocial spiritual assessment is not shared by the medical team. The medical team may want to prioritize one area of the assessment where you feel that it's important to prioritize another area of assessment. And then how do you work out those differences in an interdisciplinary way? And that could also happen because you're working with different providers with different healthcare backgrounds, and so their priorities, their mission as a discipline may be very different than yours as a social worker. What can social workers do if medical teams or organizations cannot meet the needs of the family? In the example that I gave you, our job is to find resources and support to address those needs. Um, Sometimes it's to do more macro level policy planning to be able to create the resources and support at the agency. However, if it's out of the capacity of the social worker to be able to do that, then it's to refer that client to the next level of care and use care coordination in order to do that. So the example that I gave you earlier is a good example of assessment outcomes that yield areas of need in which you need to, work those needs out with the medical team in communicating with them, helping them understand what those needs are, and hopefully by getting them buy-in and on board. And sometimes it's working out differences in terms of assessment outcomes, because as you're a social worker and your role is to do your biopsychosocial spiritual assessment, there are other medical providers there that are also doing their own assessment. Nursing has their own assessment, and their outcomes of their assessment is going to direct their plan of care. Physicians are going to have their own assessments, and everyone's assessments are important, and everyone's plan of care is important. It's how to synthesize and those assessment outcomes and into an overall plan in which all disciplines are able to move that patient forward. And again, and also sometimes it means doing critical thinking and problem solving in order to understand what is needed and what can be provided. Sometimes it's overcoming them and being solution focused with those problems, and sometimes it's realizing when the needs are too great for the organization to meet, and whether that client can be best served at another care organization. But that is the heart of social work practice in healthcare, really doing that um, going that extra step and uncovering problems and finding solutions to the problems. Again, one example of that is as we see in COVID-19. We are doing same assessments that we would with any other health condition, but there were a lot of new things with this health issue, COVID-19. The facts and the information, the data was ever changing as more information would come related to COVID-19. And sometimes the work of the social worker is to do the biopsychosocial assessment and customize that assessment for each individual patient, and also use those assessment outcomes to provide intervention. So with COVID-19, our assessments wouldn't be different, but the challenges would probably be different because information was changing and evolving week by week, especially at the start of the pandemic and understanding what we know. So that doesn't, again, change your assessment, but it may change your intervention plan. And potentially the assessment if the facts as you know it may not be always clear and accurate. And the other thing may be that specifically related to COVID-19, it may be that you have to make the call or help the medical team understand that they do not have the capacity to meet the needs of patients. So if you're doing regular and consistent assessments and you find as a social worker that patients that are in need of certain services or resources or support that is not there, it is your job to let that medical team know and let administration know. If you're doing macro level social work practice, you're actually making changes to policies and from administrative perspective or leadership perspective, figuring out what is needed to either create these programs of need that comes from your assessment or whether to maybe partner with an organization that has the strengths in that area. Um, Specifically related to the concerns that we may have. For an example, we do know that with COVID-19 specifically, it triggered a lot of mental health challenges. It was a physical illness, but a lot of people had to deal with a lot of anxiety about being infected or anxiety about caring for somebody who had COVID-19. Maybe depression about having COVID-19 or depression about having to take care of somebody, maybe sadness or mood disturbance related to losses, people dying of COVID-19, or understanding just that the amount of the severity of the situation and knowing when it's too much for a capacity for uh, um, an organization to meet. A social worker may decide to talk to administration about getting mental health services in the hospital or having a direct link to mental health services if they're in a health setting that does not offer that. Maybe a social worker may do an assessment and realize that the medical team themselves need some help and support dealing with COVID-19 in terms of the magnitude of it on the health organization. Or maybe a social worker may decide that colleagues need additional support related to dealing with the constant losses that we're seeing at the hospital related to it. There was also a capacity issue specifically with COVID-19 where a lot of healthcare workers were concerned about not having enough testing, not having enough protective equipment to wear to keep them safe during COVID-19. And that was probably an area of stress for them and anxiety, probably. And so social workers would also be um, um, transformative in being able to see that, make those assessment observations, and advocate not only for patients but also for their team members in terms of getting equipment that they need so that they can support the patients in the way that they need to and keep themselves safe as well. So this is the many roles that social workers take on healthcare settings. I know sometimes it's easier just to think of the social work role as being directly related to patients, but that is not the case. We're assessing not just the patient, we're assessing families, and we're assessing healthcare system and other healthcare providers as they relate to that particular patient and how to move that patient forward in their care. This is another poll, and this question is what are some of the interventions and tools used by social workers? So there are plenty of tools that social workers use on healthcare teams. One of the tools or methods that they use, or skills that they use even, is improved communication amongst all. This can be improved communications between providers, doctors with nurses, nurses with physicians, nurses with respiratory care, um, respiratory therapists, doctors with respiratory therapists, doctors with pharmacists, nursing with pharmacists, but also with the medical team and the patient, medical team, and the family. So improving communication between providers and between providers and patients and providers and families. Addressing challenges to meet the needs of the family. Understanding what obstacles are in the way, what are the barriers to care, and meet those needs for families and removing those obstacles and barriers. Balancing the interests of the family, the medical team, and the organization. Understanding in healthcare planning, each of these um, players have an interest. The family, the patient, the family, the medical team, and organization has an interest in healthcare, and an interest in the treatment plan, and has an interest in the overall goal and mission. And so, what we want to do is make sure that every voice is heard: the family members, the medical team, and organization. And that's part of improving communication. And also balancing the interest so that one person's need, particularly the medical team's needs and desires and plan, doesn't overshadow the family's need and desires in the healthcare plan, as same as the organization. So the social worker wants them is charged with making sure that all needs are met in the assessment and intervention phases um, of the healthcare planning. Educate family and the medical team. It's so easy sometimes to think of social work as, oh, just focusing on one unit, which is the client and or the family. But that's not the case. Social workers are constantly educating the family, yes, and the patient, yes, about things that they need to know about health care. They're supplementing the education that's provided by the medical professionals. They're educating the patient and the family about the system of the healthcare setting, the key players in the healthcare setting, how to access resources and services in a healthcare setting. And they're also helping them navigate oftentimes the insurance landscape. But our education doesn't stop there. We're also educating the medical team about the family and the family needs. We're also oftentimes educating the social work perspective and how it differs from the medical model. Accessing internal and external resources, referrals. We want to understand what the capacity and the resources and strengths are of the agency in which we work to offer that to clients and families. But when that is not the case, we need a good knowledge of what external resources so that when we reach our limits or capacity to support based on the resources that we have in our organization, we can then refer the client out to get those needs met. And we're constantly supporting the family as well as the medical team. Uh, Social work in healthcare is hard work, is challenging work. And so ongoing support is always something that the social worker is delivering in healthcare teams. Now the macro and policy practice in healthcare, and how do we look at that? Um, how do you, or what do you think, what roles do you think macro social workers play in healthcare? Based on what you know up until now, what do you think the role of macro social workers are? Often overlooked as healthcare social workers or not viewed as part of the direct practice role, oftentimes macro practice social workers don't always get their due. Oftentimes they don't identify as social workers. They may be policy analysis, health policy analysis, or they may have a different title. But you'll be surprised how many macro practice practitioners, whether they're statisticians, whether they're administrators, are trained from a discipline standpoint as social workers. And oftentimes, social workers have a hard time understanding the role of macro practice because they are not viewed as part of the direct practice role. But one thing we have to understand is that social workers and policy practice address primarily broad system issues. They're looking at team and organization and flow, practice flow. They're looking at larger policies that impact practice and so forth. The key here, though, is to understand that all social workers need to be engaged in macro policy practice. And so, even though as students, we oftentimes schools of social workers have you focus on a concentration, whether it's direct practice or macro practice. Um, we divide it for areas of specialty, and it really is focused on where social workers want to end up practicing. And so we focus or we give them specialty concentration in those areas. But it's important that you not look at these two as separate functions. If you're a direct practice social worker, you need to know about macro and policy practice. If you're a macro and policy practice social worker, you have to understand direct practice concepts too. And so all social workers need to be engaged in macro policy practice. So if you're a macro policy practice, you're already doing that. But if you're a direct practice social workers, you need to be involved in macro policy practice as well. Because what you will learn very quickly is those policies that govern your work, that determines the resources that you have, and actually outlines what your duties look like in a given institution. You'll learn that it impacts your work so heavily, you have to have a voice in that macro setting because it will influence how you work, when you work, who you work with, and the service that you're able to provide. So there are no direct practice social workers that get the luxury of not engaging in some macro policy practice. Macro practice, they assess prevalent individual patient issues and organizational response to patient and families. So macro practice, social workers who are in macro practice have to understand what the individual patient issues are. Some macro practice social workers like to have direct practice experience first so that they can understand those individual patient issues from a direct standpoint so that when they start looking at these issues from um, a macro lens and developing policies to craft a response to patient needs, they know from that experience in direct practice how to do that effectively, efficiently, and what's really needed. But all macro practice social workers do not have direct practice experience. They're also responsible for community organizing and participation in patient advisory boards and research. And so again, community organizing can meaning um, um, getting key stakeholders involved in addressing the needs of a community related to healthcare or population health or resources. They also want to make sure that they advocate the participation in patients and advisory boards and research, knowing that it's important that people who are actually impacted by the policies have a say or they're able to give their voice and actually are able to help craft policies that are for them and by them. So having patients involved, clients involved in advisory boards to help govern policy is important. And so that's another key role of macro practice, making sure that the individual patients or community members who are involved in that mass policy planning have a say so. Assist with incorporating patients in planning of programs and policies similar. If there is an unmet need, the best way to go about that is going to the source and asking patients how best to support them and making sure when those policies are developed, it has the voice of the patient and their needs. Macro practice social workers serve as advocates for patients and teach patients to advocate for themselves. They also focus on improving health system and service delivery as well. Macro practice social workers respond to public health concerns. They develop programs that address health issues, create and influence the formation of health policy, heavily involved in community education about health issues, screenings, interventions, and support programs, conduct health research to inform clinical practice, public health, and policy, and also participate in quality assurance and outcomes for evaluative purposes. Collaborations. How do social workers collaborate on healthcare teams? Methods. First of all, when we talk about collaboration, we want to define what we mean by three key terms that you'll hear often in healthcare: multidisciplinary, interdisciplinary, and transdisciplinary. When we talk about multidisciplinary, we're talking about a system or group composition of different disciplines. A group of people, different disciplines. Think a medical team with a nurse, a doctor, a respiratory therapist, pharmacist, and so forth. That would be a multidisciplinary team. Interdisciplinary teams are interaction of a system or group with emphasis on professional task boundaries. Okay. And so this is, in actionable terms, a group of people um, with emphasis on professional task boundaries. And so this is where you have highly delineated roles. And in this discussion, we talked a lot about the social work role. But again, I also mentioned it's clear to understand how the doctor plays a role in the biological piece, how the psychologist may focus in the sphere of the psychological for the biopsychosocial spiritual. You may even have a chaplain on the team to deal with the spiritual issues, and so it speaks more to how the multidisciplinary team are interacting as a system or a group. So the interaction, their roles, and how they're executing those roles in a way that has very firm professional task boundaries. And then the other term is transdisciplinary, system or group with close integration that results in accurate communication, shared goals, common language, and approach to service delivery. So again, transdisciplinary, system or group, similar to interdisciplinary, multidisciplinary, a system or group. But the tasks, there's close integration in the workflow, close integration in mission and outcome. It is a well-functioning interdisciplinary team, if you will, in that the results it's accurate communication, there's shared goals, there's common language, there's approach to service delivery. So transdisciplinary is a state. It's a state of it's a state of being, and it's where every healthcare team wants to get to that state or get to that being of transdisciplinary. Understanding the professional task and boundaries and being able to work as a cohesive system to move the patient forward. And so again, the gold standard and the goal for a lot of teams is to achieve a transdisciplinary state of being. Collaboration, role clarity and flexibility is key in collaborating. Mutual respect and trust of disciplines and collaborations, and each discipline has their own code of ethics, and it should be respected and trusted. So, good collaboration requires role clarity and flexibility, mutual respect and trust. Shared values, purpose, and commitment. Understanding that each discipline has their own values and ethics, but being able to understand how those values and ethics are shared across disciplines, and how the purpose and the commitment to either the patient, the agency, the institution is shared. An egalitarian attitude, meaning that everyone on the team is of equal importance. Oftentimes, this causes a lack of good collaboration when one discipline thinks that they are more important on the team than everyone. All disciplines are important and all bring an important role to play on these teams. Group interdependence and bond, being able to be dependent. So the doctors are dependent on the social work assessment just as well, to understand what is going on and to help them treat the patient and move the patient forward, just as much as the social worker is dependent on the physician's medical assessment and understanding what is going on in the biological sphere. Just like the social worker is dependent on the psychologist to do their assessment and intervention, um, and needing to look at that assessment before making that referral to a substance use facility, for example, and being able to form their bond, their professional bond based on this interdependence. Open, honest communication is a must. Flexible leadership, a shared governance, ability to negotiate and reach a consensus, key, very hard to do, but oftentimes the social worker is key in that. And establishing a professional and group identity, and I would add a professional and group culture. Challenges, similar to things that make or break a collaboration, the challenges to collaborations are unclear roles, or people do not understand the role of one discipline over another, or one role versus the other. Different professional values. When our standard and code of ethics provide us with one values, and the medical model provides others, and nurses have their own value system, the doctors have their own. How do you resolve that? How do you come to a consensus with that? But not being able to come to a consensus and move forward adds to challenges. Unequal voices in the care planning, as stated, all voices are important. They all need to be heard and brought to the table. Unequal voices will compromise collaboration every time. Ethical clashes, changes in healthcare setting, can also impact collaboration. There are always changes that occur in a healthcare setting. There are too many to name here, but it can be an environment, it could be leadership changes, it could be policy changes, but all these things can impact collaboration. Financial and resource challenges can affect collaboration. When you, as a team, you have a good plan in place to help move the client forward, but if the finances and resources aren't there, it can also compromise how you collaborate with other providers, particularly when you're actually reaching out and needing other providers for resources to add as resources. But if there's no financial support for that, that can really break down a collaboration quickly. And policy priorities. Oftentimes, there are policy priorities that just need to be met for an agency, and so those policies sometimes can trump the teamwork piece and the task. So, for instance, if there's a policy in the hospital that would want to prioritize um, patient-centered policies or patient-centered um, 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 planning, those policy priorities may favor social work actually, as the health as a lot of health settings are medical model. When there's a shift to being more patient centered, that tends to be more a biopsychosocial perspective and a social work perspective. So those policy priorities can um, cause challenges in collaboration, especially when nurses and doctors are not used to practicing in a patient centered, person centered way. And so the social worker may adapt very easy to policy changes that are patient centered, but maybe other medical providers, such as doctors and nurses, may not. Where there's policy or priorities that are more focused on the medical model, that may challenge the social worker in terms of how to collaborate with their team with those policy priorities. This video was a little longer than normal, but the whole goal is to help you understand the role of social work in healthcare settings from a micro, meso, and macro perspective. And as we move along in the course, I want you to think about the role of social worker and how it plays from a micro, meso, and macro level, with more focus on meso and macro for this setting as we move along the other chapters in this course. Thank you.